Winnipeg Fire Paramedic Service, what's the address of the emergency?
21,000 times a year, Winnipeg police are dispatched to mental health and well-being calls. But local organizations say it's time to overhaul the system.
The police presence is not absolutely necessary, and it can actually do more harm than good.
The Police Accountability Coalition wants community-led crisis response teams to take the lead and be the first line of defense. On the streets of Eugene and Springfield, Oregon, that's already a reality. Emergency calls are often redirected to Cahoots, a mobile crisis intervention unit, teams of unarmed medics and crisis workers. There are no lights or sirens. Instead, a white van pulls up. Two people in street clothes emerge, there to help. Crisis workers do not have the ability to arrest or detain or force people to do anything they don't want to.
Our goal is the least intervention necessary. Most calls we resolve in the field without transport at all.
Cahoots respond to around 24,000 well-being calls a year. A few thousand of those are a co-response to a police event. But they attended as the sole first response to 17,000 of the well-being calls. In 2021, they only called for police backup 300 times.
Only 6 times was that come lights and sirens. So once every other month in a year, Cahoots is needing emergency police backup.
It's an alternative to armed police interventions, and it's working. They handle 85% of welfare checks in the area, even calls that involve potential weapons or violence.
I cannot stress this enough. No Cahoots worker since 1989 has ever been seriously injured on a Cahoots call.
In Poughkeepsie, New York, People USA is doing similar work. They don't carry weapons. They're armed with words and lived experience. All of their team members have overcome addictions and mental health and can relate.
I think people need to hear more from people with lived experience that are in recovery in a good place and hear their stories, because they've come from these devastating, traumatic lifestyles and environments, and now they're in this recovery. I think it's good for people to know what happened, what changed.
If they respond with police, officers are out of sight and staged nearby. They rely on extensive training.
Get official training by police on safety, on where to stand, how to not block yourself in, those kinds of physical safety issues. We don't do any intervention, a physical intervention of any kind with people.
They also provide law enforcement with 40 hours of crisis intervention training, teaching empathy and compassion.
By the end of that training, they do understand it, and they do have a better tool on their tool belt instead of the taser or the gun or the handcuffs.
And hopefully one day, it leads to a world where fewer people end up dead when they call for help. Brittany Greenslade, CBC News, Winnipeg.